Well, hey everybody, I'm Nina Crowley. I'm Seeka's Professional Affiliations and Education Manager, and I'm here today with one of my favorite people to talk to. We're going to have to really limit it to only 10 minutes, Ted. But
I'll do
this
my
is
best.
this is Ted Kyle, so hopefully you know who Ted is, but I'm going to let him do a little introduction in case you're one of the few people who don't know Ted, and then let's jump into talking about a conference that he just got back from, the American Diabetes Association Clinical Update Conference.
Well, Nina, yeah, for folks who don't know me, I'm a pharmacist and an advocate for people living with obesity, living here in Pittsburgh. And I've been working in this field for, well, really more than 2 decades, a little bit. All of the work that I do is really aimed at pushing the world toward a more rational, more grounded in science and human needs approach to obesity.
And that's why we love you, Jen. So everyone should also be following your blog, which has daily information about what's going on in the field. I think that's one of the best places if you're going to, read something in the morning. We also know Ted gets up super early, so it's definitely out first thing before any of us wake up. But Conscious Health is his blog, and I think that really it keeps a very balanced approach. I think to what's going on in the field of obesity, and really, like you said, with that human approach and really putting the patients first. So I won't get into our long history and knowing each other through the OAC, but I do, I do feel like you're one of the few people who I align with on pretty much every topic we've ever had a conversation about. So,
Maybe that's because I learned a lot of things from you.
well, let's tell me a little bit about this meeting you just got back from. I was excited to hear the conferences for the new year are back on, and wanted to hear about it a little bit.
So every year, the American Diabetes Association releases an update to what they define as the standard of care for diabetes. And this conference serves as a place for them to roll it out to a few hundred allied health professionals and primary care providers and endocrinologists who treat obesity. And this year, there is a really good part of these guidelines that is devoted to obesity care. And so at the conference, they devoted a whole morning to the subject of obesity. And I was part of that section talking about weight bias. But there were some other excellent discussions in that section.
I've always been impressed with their standards. The past couple of times I've read them, they're always on time, right? Annually they come out. I think they really do a good job with people first language and really kind of seem to align with what, we know should be standard of care in the field.
Well, you're right, and they made a point of that in their guidelines that an essential to providing good care for type 2 diabetes and obesity is to provide stigma-free, patient-centered care with shared decision making. And I know that's one of your core values, and it certainly is one of mine.
Yeah, absolutely. So your talk was on stigma and bias, of course. And I'm
That's
sure.
right. And I really talked about three things. One is, sort of how stigma and bias, both biased ideas about obesity itself and biased ideas about people who have it, have gotten in the way of us making progress against obesity for these last 4 decades. And then just how that harms patients and how we can overcome it.
Okay. Well, I think, the physiology component of, how that could be intertwined with bias and obesity, that has really been it's something that I'm interested in having, you sort of share, because I think that's something a lot of people don't think about. How does that intertwine? How is that bias the way that we look at physiology?
Yeah, it's a really important point because it becomes sort of a doom loop of bias and obesity that starts. Someone finds themselves living with obesity, and then that obesity creates stigma that they experience every day, and that stigma creates stress to which there's a physiologic response. And the result of that physiologic response to the stress that comes from dealing with a daily onslaught of stigma is to gain weight and for that problem to become even more acute. And most recently, some folks published a study that I highlighted in my slides, and I know you're going to link to the slides, so I would encourage you to look for that study in the slides, where they actually did a randomized controlled study of exposing people to a video that had weight biased content versus a weight neutral video. And there was a physiologic stress response to that. And that stress response wasn't just acute, it persisted through the night and into the next day. And that,
Mm.
that really sort of answers people who might say, yeah, it's just an association. No, it's cause and effect.
I think that's huge. I mean, we've talked about that physiological stress response a lot, even in, why we need to make environments, inclusive for people of all sizes. And, like my former bariatric program, I think that was big, but having a new study on that's helpful for sure.
That's absolutely right. And this is a large part of why we're having such a difficult time with progress against obesity, because much of what we've been doing has been grounded in false assumptions about the disease and about the people who have it, that if we just beat them up enough, that's not really the intent, but it is the result, then maybe they'll get on the right path. And that's not the case. Obesity is a problem of physiology. It's a problem of the biology we inherit interacting with the environment that's all around us, that produces weight gain.
So when there's a physiological issue, I think that has also been interesting in how we're talking about some of the new anti-obesity medications that have been getting a lot of, it's odd, right? Like we want a lot of attention towards this treatment and the solution in this disease. But then now that we've had some, a lot of media attention about the anti-obesity medications, the semaglutide, the Wegovy, and the Ozempic, it's not always positive. It's not moving in the right direction. I've been disappointed with the way that's presented in so many different articles, although there have been some good ones as well. But do you feel like, any comments on how the way that we're presenting that in the media, how that's biased and how that might not be advancing the cause to get people, to better health, which is, I know what you believe, this is about health and not just weight loss.
Well, that's exactly right. And what happens, where this happens in the subtlest of ways, is when people think about this in terms of weight loss. And that's not to say that weight loss is unimportant. It's important to a lot of people to reach and maintain a lower weight, but that's not the point. The point is better health. And along the way, one of the reasons that these drugs are so impressive is because that they do help people achieve and maintain a lower, healthier body weight. But the real end benefit is better health, better functioning, better quality of life. Weight is part of that, but just losing a few pounds and then getting on with your life is not how it works, because this is a chronic condition where the physiology of your body is not doing its job of regulating weight to a healthy level.
Right. Well, and I've seen some stories, focusing on like, oh my gosh, like we really have to take this forever, like that sort of this, like you said earlier, false assumption about obesity. Like, okay, you're
Right.
going to take this just for a short period of time, drop those few pounds, and then sort of move on with your life. And I mean, as a pharmacist, that's not true, right?
Yeah, but I run into pharmacists who don't understand obesity and think in those terms. I mean, can you imagine going to the doctor and having him say, "Well, we're going to knock we're going to knock your blood pressure down, and then everything will be fine, and you won't have to do anything else." Well, sorry, that's not how it works. I take a little bit of lisinopril every day to keep my blood pressure at a healthy level, and I know that if I stop taking it, my blood pressure is going to go back up. So,
So
what's
why do
hard
we?
about understanding that?
But why is it? Why don't we understand that? I think it comes back to bias.
It comes back to bias. It comes back to the social concept that we have about weight and health, and the presumption that obesity is a condition of choice, which it absolutely, positively, if you understand the science, is not.
That's well worded. Yeah. Well, I know you're on a mission to rectify that in your lifetime, and me too. So,
Right.
what I mean, any take homes from your talk, from the meeting, about like what people can do? How can we change our mind about that if people find themselves having some of those thoughts or behaviors that you described that are kind of biased?
I think the thing that I would say is that everybody needs to examine their own biases and realize that as time goes by, the explicit bias that people used to get by with is no longer okay. And so there's less of that. But what there is out there is a lot of implicit bias. It's that little those thoughts that creep in to what you're thinking about. And one thing is that's very important, especially for healthcare providers, is to meet people where they are, to spend as much or more time listening than you do talking.
Hmm.
I had Gary Foster, who's a brilliant individual in this field, once told me, if you're talking half the time to a client or patient about obesity, then you're talking too much.
Hmm. Yeah, and that curiosity approach of, how I think that's the best, sort of way to approach this in someone's experience. I think a lot of times these days people don't know what to say. What words can I use? What words can I use? Is this going to offend someone? Like, I don't know how to bring up this topic. And I've found you don't have to know the answers, because the answer for the general public isn't necessarily going to be the answer for the individual. So I think approaching it from what's your experience with bias? How has that been in your life, and how have you interacted with that? What other healthcare providers, how had those relationships impacted you, and really kind of go from there to helping them to a better place. I think that's an approach,
Right.
shared decision making, patient centered, and sort of a curiosity empowerment approach really is something all providers should really be spending some more time learning about.
Absolutely. Or, to put it simply, listen first.
Yeah. Well, I'm always listening to you, Ted. So I think that's a good stopping point for us today. But I appreciate your comments and letting us know about your talk. I will link to that so that folks can sort of see kind of the progression that you take through the timeline. I think that's always helpful for me to see in your slides the timeline of how obesity as a disease has been conceptualized, and how that has kind of played out with implications in our treatment approaches as well.
Thank you so much, Nina. It's a real pleasure talking to you.
All right. I'll see you at our next meeting.
Okay. Thanks so
Thanks.
much.
Bye.
Bye.